whether you're old or young, diabetes affects everyone, and also men and women. It doesn't matter which. I'm here to talk about type 2 diabetes, because type 2 is diagnosed 90 to 95% of the time that diabetes is diagnosed. Let's see. So right now, what we have is, there's some research to support a diabetes prevention program, which I mentioned in my elevator pitch. And it does include physical activity, access to lifestyle management coaches, and it's not in wide use yet. But it does show that it decreases the onset of diabetes by 58%. And in people over 60, the decrease was even greater, 71%. So prevention or delay of type 2 diabetes with lifestyle intervention has been shown to persist for at least 10 years. Research shows that lifestyle interventions are more cost-effective than medications. So I want to talk a little bit about how diabetes comes about. The importance of insulin that's excreted by the pancreas is the major contributor to whether or not diabetes develops. And so what insulin does is your cells receive insulin through a receptor, and then that puts forth a protein activation cascade that causes a protein, the GLUT4 receptor, to go to the plasma membrane to receive glucose into the cell. So I have some graphs here about how diabetes actually affects our nation. And so diabetes is the 7th leading cause of death. And right behind that are I've listed 4 of the other leading causes of death. However, 2 of those are actually closely related to diabetes, and many times are caused because the person already has diabetes. Also, the bottom graph shows what we spend each year in some of those leading causes of death. And so diabetes is actually the 3rd most costly disease in the United States. But again, if you look at heart disease, it's oftentimes the result of someone having diabetes in the first place. And then that's followed by Alzheimer's and cancer. So what can be done? The research that's been shown as far as the diabetes prevention program shows great results. But I really think that it could have improvements, because it currently includes the So like I said, it includes the lifestyle case managers, 150 minutes of exercise per week, equivalent to brisk walking, and also, let's see, a 16-session core curriculum. The paper that I read that detailed this didn't show what is part of the core curriculum, but what changes I think that can be specifically made are in nutrition and also exercise. There's also a genetic test for diabetes in which 11 genes have been identified, mostly by single nucleotide polymorphisms. And so I think what we can do is make a test that's available to everyone and that is cheap enough that people can afford it, especially because we need a specific test because diabetes is so widespread. And so that's what I plan to do, and the details are in my proposal on how I would design the genetic test and also how I would design the core curriculum to help people understand what happens as a result of being diagnosed as prediabetes, but also before that phase. And then also design a way to increase education for the healthcare community by letting them know that we should Oh, I'm out of time. We should implement genetic testing even before the prediabetes phase. So I need your help with funding and also implementing policy changes for the healthcare community that we can save the lives of millions of people. Okay, questions?
The same question I asked last week. What's the heritability of that?
For one gene, which
for the whole panel.
I didn't get results on the whole panel, but there's one gene that's most commonly tested for. It's TCF7L2. It's 26% is the heritability right now.
Right. So do you know what that means actually?
That if you have the single nucleotide variant of that gene, that you have a 26% chance of developing the disorder.
It means that 75% of your risk for diabetes is environmental. So among genetic diseases, diabetes is one that has one of the weakest genetic components of all. So 3/4 of your efforts should go into diet, exercise, and education. And it pains me to say this as a geneticist, but genetics is almost irrelevant.
Well, as far as the documentation I read, it said the opposite was true. And that was the whole idea behind what I was doing, is to combine those efforts, because it is true that environmental plays such a huge role, as in all genetic disorders. But in using them in combination is the key, I think, to really making changes. So.
Yeah, it's probably not a bad idea to have a genetic screening. Genetic screening is getting cheap enough, so it can be done for everybody, for everything. And there's certainly a diabetes component of that, so I wouldn't argue with that.
Yeah, it's not deterministic, so. Well, any other?